Hello. Today we are going to talk about a specific therapeutic technique that will not only address speech-related issues but also help in overcoming feeding problems both in children and adults. This technique is called oral placement therapy. Problems stemming from any kind of childhood disorders like Down syndrome, cerebral palsy, autism spectrum disorder, to adult disorders which are more related to neurological causes like stroke, Parkinson's disease, or even breathing problems, head and neck problems, all of these can be addressed. The childhood problems can range from postural issues in children related to feeding like a stiff back, if the child is crying or fussy during feeding, any kind of breathing problems related to eating and drinking, the child simply refusing to eat because they have issues with the texture of the food, taste of the food. They take a longer duration to eat because they have chewing or biting related problems, and also going as far as when the child drools or the liquid comes out of their mouth or nose. They cough or gag during meals or even throw up frequently. Their voice becomes very gurgly, hoarse, and because of that they are not able to gain weight. The speech problems that can be treated include dysarthria, where there is an articulation problem and the words are not formed clear. There is problem with fluency of speech, planning of speech, or even when some words are not clear compared to others. The oral placement therapy is a way by which 3 basic stimulations are provided, which include auditory, which is in the form of the instructions given, a visual medium used, as well as a tactile or touch-based stimulation that is provided for both speech and feeding problems. There are 10 main tools that become part of oral placement therapy. These include chewing tubes. Chew tubes have a benefit of providing function for both biting and chewing. So it helps in various functions like opening of the jaw, stimulation of the oral structures with touch. There are different colors available like yellow, red, orange, green or blue, which depends on the firmness that keeps on increasing. The second tool is called as a Z-vibe. It has a vibratory effect, so it helps in improving both the tone of the muscles and the overall sensation in the mouth. The third tool is called simple horns or whistles that are used. They help in stimulating oral muscles and also help in speech clarity. The fourth tool are jaw grading bite blocks. They help in improving both jaw strength and also their stability. So for problems like dysarthria, where the words are not clear, or dyspraxia, they are very beneficial. The fifth tool are simple straws, because they help in creating a jaw, lip and tongue dissociation. The sixth tool is an infant toothbrush, very simple. It helps in tongue lateralization and it also provides a sensory effect and helps in stimulating bite. The seventh tool is called as a honey bear drinking cup. This kind of cup helps in reducing forward tongue thrust. The eighth tool is called as a Nuke Brush, which is basically a desensitization tool. So if the child is specific about textures or they are not comfortable with food or other feeding utensils in the mouth, this is a very good tool for them. Then the ninth tool becomes a tongue tip lateralization tool. And finally the 10th one is an oral sensory integration kit. This video was just to give you a basic idea of how oral placement therapy works, what tools it involves, but I would always recommend going to a speech therapist or a certified person who knows how to perform oral placement therapy in order to address the speech or feeding related issues that any child or adult might be facing. Let me know how you felt about this video. Leave it in the comments below. Like and subscribe the channel, and we will meet again. Bye.